Hello friends, welcome to the show Talk with your Doc. I am Dr. Prashant Tijani and with me is Dr. Gabriel Mapeso, who is a surgeon at Thunder Bay Regional Health Science Center in Thunder Bay, Ontario, Canada. Today we are going to talk about inflammatory bowel disease. Inflammatory bowel disease are the disorders in which a segment of gastrointestinal tract becomes inflamed and ulcerated. There are two main types of inflammatory bowel disease, ulcerative colitis and Crohn's disease. And they are very common in Canada and in the developed part of the world, including North America and Europe. It is estimated that 250,000 patients at this time are suffering from ulcerative colitis and Crohn's disease. And it is very common in Canada. The prevalence of this disease is increasing every day. There are about 5,900 children are affected with inflammatory bowel disease. And it is a lifelong disease which has impact on the personal life, the social life, and the economic life of the patients. It is estimated that in 2016, $3 billion was the economic impact of inflammatory bowel disease in Canada. So it is a very important disease which is very common in our part of the world, and today Dr. Mapeso is going to enlighten us with various causes of disease, various risk factors, various investigation methods and treatment options available at this time. Thank you, Dr. Mapeso, for coming to the show Talk with your Doc.
Thank you for inviting me over as well.
Please share us about your experience with inflammatory bowel disease in terms of what are the causes of rising incidence of this disease of ulcerative colitis and Crohn's disease in Canada.
This is a very interesting disease because if you actually read any book about it or journals on it, they always start off with the point that the causes are unknown. However, there are a lot of risk factors that are associated and they think it may be the cause of it. So it could be diet, could be environmental, it could be an infection that has gone wrong, or it could be the bacterial flora in the body, which is the new thing now. Your bacterial flora in the gut may make up you, whether you are sickly or not. It all depends on that. And also they think it's something to do with the immune system going haywire in the body that attacks your bowel. So the one thing for sure, as you have mentioned, that it is more common in developed countries. It's very interesting because some people who come from countries where it is very rare, when they come here to North America, they seem to have an increased incidence for the same group of people.
Yes, I agree with you on that. I have seen that quite a few Asian families, when they come to Canada or North America, their children tends to get more of this inflammatory bowel disease than their parents who are coming from Asian countries.
Yes.
So is it related with diet and environmental factors as well?
Environment, they say, is a factor. Diet, they say, is a factor. But one thing for sure, the mechanism, whatever triggers it, the mechanism is something to do with the immune system. So the immune system starts to target the cells in the bowel and they become inflamed.
So, what happens to the patient? What are signs and symptoms of ulcerative colitis and Crohn's disease?
The symptoms can be minor. They can have mild abdominal pain, cramps. They have what they call, some people label irritable, your bowels are irritable, they get diarrhea. And then we go to more serious things like fistula, fever, severe abdominal pain, obstruction, and in some situation the infection is uncontrolled. You perforate the bowel too, that can also happen. And so you have mild to very severe. And the most important thing is if there is something wrong with your bowel, to have it checked so that to see if you have this disease or not.
So if somebody's family, say first group of member of family has ulcerative colitis or Crohn's disease, and they have all these symptoms of loose motions, bloody diarrhea, and weight loss, and all other pain in the abdomen, cramping, all these symptoms, what are the chances that the other members of family will get this disease?
Well, you are considered high risk, but not necessarily you will get the disease. But you're certainly at more risk than others if you have a strong family history of ulcerative colitis. So I agree with you, hereditary and genetic factors is a factor, but not everyone in the family will get ulcerative colitis. So there is some triggering mechanism, and that's what they're trying to find out, what triggers the inflammation. So you are at higher risk if you have them. So if you have any symptoms and there are relatives that you have them, then you should be investigated for it.
So now, how does this ulcerative colitis and Crohn's disease affect our day-to-day life?
Oh, it is very devastating for some people. And like you say, you mentioned very well that it is a very costly disease because for some people it interferes with their lifestyle and they get admitted to the hospital, and some of them become totally disabled. And we've had patients who are in the hospital for many weeks and sometimes months who have complications from the disease. So it is very devastating. Or they have people who get minor attacks here and now, or major attacks, and then they get better. Then they come back again to the hospital, they get admitted, IV antibiotics, excluding, I'm not even talking about the surgery. Some people have the surgery, and then that's also another cost to the healthcare or to society as well, because it is very devastating.
Right. So patients with ulcerative colitis and Crohn's, they have to go to the washroom very repeatedly. So their career choices might also get limited, right?
Correct. It affects their work environment. They have to be off work for that. And also, some people actually consider themselves cannot return to the force because of their disability. So
they have to go use frequent washrooms, and that accessibility, the personal lifestyle also gets affected. Relationships get affected.
That is true. And can you imagine if you're in a board? I remember a patient very well when he had inflammatory bowel disease. He could not, and he was a very good executive worker in a company, but he could not stand in the meeting because if the meeting goes more than 30 minutes or an hour, he has to go to the washroom, and then he has to clean himself and come back. And he just could not. And then when he is a salesman too, I also know about a salesman. Can you imagine talking to your your customer, and then you really want to go to the washroom or else you're going to have diarrhea. Yeah. So it is the impact is very devastating.
And one cannot travel also, right?
If one cannot travel as well. And can you imagine traveling and then you want to go to the washroom? In fact, you have a very good point. Another patient of mine, he said he was very thankful when he finally had an operation and he had a bag. This is one of the few patients who admires to have a bag, because now he says, I can drive, I can sit in a meeting, and even if the poop comes out on a colostomy or ostomy bag, he finds it very, very convenient rather than running to the washroom.
So we can see that ulcerative colitis and Crohn's disease are very debilitating diseases.
It can be, yes.
It affects the personal life, the social life, and the economic life as well of the person. Yeah. So how can we diagnose it at an earlier stage?
The diagnosis usually they occur commonly in people who are younger, usually in their 20s or 30s, and then there's a gap where there's not much incidence of it. Then it comes back at around 50 and 60. There are a few people who will get it around 50, 60 years old or a bit older. So again, the symptoms are typical, generally diarrhea and going frequent to the washroom, including bloody diarrhea. And in worst case scenario, you will have your very first episode, maybe a major abdominal pain, obstruction, bloody diarrhea, and that might be when you are diagnosed to have it.
So those are early signs and symptoms.
Those are early signs and symptoms. And so the more severe the disease, of course, the more severe the symptoms.
Thank you, Dr. Mapeso. We'll take a short break and we'll come back and talk more about inflammatory bowel disease and know about it from Dr. Mapeso. Thank you.
Thank you.